let's talk about drug management for a moment.
Okay.
Because obviously the new triptan family, etc., is excellent for acute attacks of migraine, but it's not much for preventing migraine.
Absolutely.
What is? Is there a safe pharmacological preventative?
Well, you know that the answer to that is there's nothing that's perfectly safe in terms of drug therapy. I think there is a balance that one has to measure between what is safe for an individual and the severity of their disease. Part of the problem is we have a culture where it's almost kind of a knee-jerk reaction to write the prescription. And I would suggest that the cornerstone of all migraine therapy is not whether they get acute or prevention, it's whether they get education and understanding. People come to me all the time saying, fix my headaches. And I'm saying, you know what? You were born with this very sensitive, genetically sensitive nervous system, and your real goal here is to learn to live successfully with it.
Or to fix your life.
Yeah. It's between attacks of headaches as well as during headaches that you have to pay attention to your own function. And giving that education, teaching people the things that they can do to make their nervous system resistant to migraine is very crucial. Now, as you know, and certainly was the case when you were seeing a lot of the chronic pain patients, most of the time, by the time we're working with somebody, they're on the far end of that spectrum. They're having daily headaches. Their life is totally impacted by these. And, at that point in time, we do have medications that, in many instances, maybe 50% of the time, can actually seemingly help, as done as part of their program to get them back into, a pattern of headache that they're under better control, less impacting on their life. But they all carry with them risk. My favorite patient to see is when a parent has realized that they suffer from migraine, their child is now suffering from migraine, and they bring that child in to see me, because that's where we can really make an impact and offer them things like biofeedback, offer them an understanding of their diet and things that totally impact it. And parents are very open to not having their children on drugs, but they're often resistant and want it for themselves. So it's that paradox. Compliance is a huge issue, whether we're talking about the use of alternative therapies, things that you've mentioned, or some of the things I've mentioned, or we're talking about medication. And I always try to get across the idea that it's not so important that I understand something about you as a patient, but that you understand and you start making the decisions that are going to affect your life and help you. And it's really that transfer of information and that transfer of motivation that's so key to getting people well.